Teething usually starts around 6 months of age. We will see very rarely teething starting at 4 months or in between 4 and 6 months, and that's usually if a parent has had a history of early teething. They do start drooling and putting everything in their mouth around 4 months, but that's a developmental milestone that is normal. So around 6 months, you'll start to see them drooling more than they have been, putting everything in their mouth and really chewing. And usually you see the bottom 2 incisors erupt first or come through the gums first. They will be fussy, likely have a little higher temperature than normal, not a fever, so we won't see anything that's 101 or more. It'll be 99 or 100. Sometimes sleeping is affected. They don't want to eat because it hurts, their gums are hurting, so their appetite goes down. I would definitely utilize pain control measures with Tylenol and ibuprofen depending on the age. So if you're 4 months, you're going to use the Tylenol. If you're 6 months or older, then ibuprofen. Also using cold things so they can chew on cold rings. You want it to be a solid one-piece ring. You can put a wet washcloth in the freezer and they can chew on that. You can also try to time your ibuprofen or Tylenol about an hour before you want to feed them a meal, so maybe their appetite is a little bit better when it comes to drinking. We really hesitate on recommending any of the Aura gels or the teething gels just because they're pretty slobbery. They're not going to really stay where you put them, and there can be some harmful side effects if they were to get too much of that. Some kids, they'll teeth and they'll be done and over with, and it's a very short time. Other kids, it drags on what seems like forever. But once the tooth finally erupts through the gums, then the pain usually starts to subside and their appetite comes back.